Hello again, everyone. My name is Marty Guthmiller, and I'm the CEO at Orange City Area Health System, bringing you today the 32nd edition of our COVID-19 community briefings. I'm going to give you some information today, mostly good news, and in very much in the same context as I've provided in the past. I do not have a local scoreboard update for today. Again, our rate on Monday was 8.1%. We haven't experienced anything that we would expect to be different than that, and I will make sure that I do give you a full update next Monday as to what's happening locally. But I do have a county update, and again, it's very good. We've only had one new positive in Sioux County this week. So the number of positives in the county is 424, and that's of 2,606 tested. And as you know by now, I think the positive rate is an important number, the percentage, and that is at 16.3%. We have tested 1 out of every 13 Sioux County residents at this point. As has been our practice, we're going to step up a level now and look at Region 3, 20 counties in Northwest Iowa. Good news there continues. 36 hospitalized in Region 3 in these 20 counties. That is down from 39 on Monday and 70 from last week. So in the last 24 hours, we've had 2 patients admitted in those 20 counties. There are 12 ICU patients in Region 3, down from 14. So all statistics in Region 3 are trending downward, or trending, in this case, positively. Stepping up from Region 3 is the state. For the first time in a long time, probably since we've been recording this information, we've dropped below double digits on a percent positive rate. The percent positive at the state level is now 9.8%. It was 10.1 on Monday when we talked. There has been 26,947, so almost, excuse me, almost 27,000 positives in the state. We have tested now 1 of 12 Iowans, 1 out of every 12 Iowans. So again, good news, below that 10% mark, getting closer to what we've actually experienced here at the health system, which is more around the 8% level. As we talked about on Monday, I basically used 2 criteria to look at these numbers, and I've talked a little bit about that already. I would ask that you pay attention to the percent positive rate, not the number of positives, because our testing number is going up, and so there are going to be more positives, but it's the rate of positivity that is important to me. Also important is the hospitalizations. Then that's a measure to me of the acuity level, how sick people are. And you can maybe argue a little bit about how patients determine whether they're symptomatic or asymptomatic. It's difficult to argue with whether they've been hospitalized or not. Those are some pretty hard numbers. And so I always use hospitalizations. If our hospitalizations are going down, the level of acuity is low, and that's a good thing. The number of hospitalizations in the state of Iowa has dropped 50 since Monday. It was 181 on Monday. It is today 131. The Sioux, Lyon, and O'Brien County remain at 0 hospitalizations. Plymouth County has 3. Clay and Dickinson County, which we've heard a lot about recently, have 0 hospitalizations. BV County is down to only 6 at this point, and that's down from 15 on Monday, so a significant drop off there. Woodbury County down from 22 to 17. Polk County down from 41 to 29. So significant trending downward in terms of hospitalizations, which means, again, the acuity level of the patient, of the sickness, is low enough that is not requiring hospitalizations, even if you see a number of positives increasing. One number that's not going down are the death numbers. That number has increased 8 since Monday to a total of 694 deaths. We have to keep thinking about that and keep mentioning that in terms of this battle isn't over, this race has not yet been won. And it is a marathon, not a sprint. I mean, all those kinds of things you can talk about. We need to maintain vigilance, particularly in our senior community. I believe the number is something like 87, 88% of our deaths are in the above 61 category. And so we want to be particularly careful in our nursing home environment. One of the things you're going to hear a lot more about, and I've talked a little bit about, there's a number of things that might refer to this test, but it's called serology testing, or IgG, or the layman's term is antibody testing. So this is an antibody test. It's a blood test that determines whether or not antibodies to the coronavirus, COVID-19, are present. One of the things that it tests is whether it was present or not, but the presence of antibodies doesn't not necessarily equate to immunity, and we don't know how long the antibodies will be present yet. So there are still some unknown questions regarding that, but nonetheless, antibody testing can provide some value to you, maybe some peace of mind perhaps. You know, we all have friends who said, I know I had this thing back in January. I know I had it in February. We were so sick. Well, now they can find out and they can know that. So we will have that test here at the health system in early July, available to the public. There will be more information coming on that. We're actually doing some internal staff testing with it now, but look for an announcement on that in the very near future, and with testing to begin to the public in early July. Basically, though, the test numbers that have been performed in the state of Iowa are relatively low. They're at 30,567 IgG tests, antibody tests. The positive rate of those tests are only 7%, so 7 out of every 100. So of the 30,000 tested, we've had 2,235 tests, today. One thing that you need to remember as we move beyond testing now is the 6-15 rule. We haven't talked about that a lot, but maintain 6 feet in distance from people whenever possible, and for less than 15 minutes. And so it's the 6 feet, 15-minute rule. So the 6-15 rule. Use common sense with this, as we've talked about before. Live your life. Mask when you're not able to do 6-15. Avoid large gatherings, but enjoy the outdoors. It's a beautiful day today. It's a beautiful time of year. Get out there, use common sense, and apply that 6-15 rule as much as possible. Another reminder, coronavirus.iowa.gov is one of the best sites that we found, and what we surely recommend to you to check if you want to do a deep dive into a lot of other information. It's where we get all of our information, and so you can, if nothing else, verify what I've told you. But be very careful of other sites like weather.com, as an example, which still shows today 188 deaths in Sioux County from the coronavirus. Simply is not factual. It is not true. The number of deaths in Sioux County from COVID-19 is 0. And so be very careful where you get your information. And if you're on the site and you want to go, again, it's coronavirus.iowa.gov. This will be my last briefing for the week. We do anticipate being able to bring you some updates on Monday or Tuesday of next week. Again, probably some more on the serology testing. Definitely update you on the scoreboard and anything else that might be going on. Maybe even some visitation policy that's changed, those kinds of things. So look for that next week. In the meantime, we ask you to stay vigilant, to stay strong, and stay healthy. Thank you again for joining us for this briefing.